You can do
This
that as well.
conference will now be recorded.
And I'll repeat that actually in a few minutes. I'm hearing a weird echo on me. That's kind of funny. Nothing's worse than hearing me twice. But anyway, just for those that are on the call, wanted to welcome you, say hello, and that this session is really here to help out our member camps going through Gold Ribbon, to ask questions about standards, about documentation, about the process, whatever you'd like. There really is no structure. We're just kind of here to be available. I know Jennifer's on the call. Don is on the call as well, both from COCA. I'm here as far as the committee, but I see that there's a few people on. And so if you want to, you can either type in questions in the chat. If you can try to navigate the audio, you can unmute yourself. And once again, just ask questions. I've put up the, and please feel free to do that. I put up actually the front of the standards. We can actually go to whichever standard someone is asking about or questions. So we're here for you. So let us know if there's any questions out there. And then once again, this can be about the standards. It can be about the process, whichever. Really, we're kind of here at your support. So let us know. And this is those awkward pauses.
Hey, Brian, how you doing?
Hey, I'm doing well.
Good. We'll shoot a question out for you. As far as written documentation on some of the standards, the expectation for them, and I'll use, for example, 6.2.
Okay.
Does the camp have a policy for dealing with the communication of the death of a camper or staff member?
Right.
We have a kind of a verbal policy where we'll kind of alert the staff when that happens, but at this point, not a physical written documentation on that. So wondering exactly what do you mean on something like that? Are you looking for us to put just something down on paper on that, if a child passes away, we'll email each of the staff members connected in the office type thing? Or I guess I'm just trying to get a feel for, rather than just create something for the sake of creating it. I mean, we've always internally just contacted those that were connected.
Yeah, no, great question. Great question. And if I can, let me take a minute and kind of back up about what's the reason for all this documentation? Because I know that a lot of us do really great stuff and we have certain ways that we do it. So the idea with documentation is this, and then I'll get to the specifics about this particular standard. But the idea with documentation on so many of these is we know that there are what I would call procedures in place, or there's practices in place at our camp if one of these situations would arise. In this case, if there is a death of a camper or a staff member, and then it becomes like, so why should we document it? We just do what we do. Well, here's one of the reasons that we have found, and that it's been proven with regards to operations of camps and organizations, is that even though we might have practices in place, that relies on kind of building a culture, or it might rely on one person that is the one that's going to respond if that happens. And many times that sits on line with us with the director. And we have found that for the stability of the camp organization, and really bottom line, for the support of our staff, our volunteers, and for the campers, it's best that if we try to document these, if for some reason, and gosh forbid, but if for some reason, if one of those pivotal people who is looked upon to handle these has to be called out of camp, is sick, or those kind of things, it's kind of like, oh, they're not here, what do we do? And so we find that it's a best foundational practice to document these. So that's kind of all these kind of procedures, practices, and even culture and philosophy. So that's kind of the basic part of that. Now, to get down to the answering this question, what I would suggest is, is there something that's just a real quick, and it doesn't have to be elaborate, But what would happen in case there is a death or a staff member? Now, some of that might have to happen if that happens throughout the year. What would you do? Camps over during the year, we find out lots of times that we have campers that pass away. We at our camp, as a matter of fact, just had a staff member that passed away. How do we handle communicating that to our community? What are those things that we have to think about with regards to right of privacy? What methods do we want to use to communicate? Because this has to do with emotional safety for our campers and for our staff and for everybody in the organization. So how would we handle that? Gosh forbid if it was a death of a camper or a staff member that would happen at camp. And we've also asked with regards to policies and procedures with that as well. But how would you actually deal with those? Who would you notify? How would you want to notify them? Do you just want to do it by email? Do you want to call them individually? How do you as an organization want to handle that? And taking into account, once again, privacy, healthcare, health information privacy, but also supporting as a community. So really it's I would suggest if you do have this kind of as a practice in place, those members gather around the table, say, so what do we do? How would we do that? If one person's not there, another person's right there, how do we do that to make sure that we're covering all that? And just it can be in a quick paragraph, it can be in a bullet list, whatever like that, but that would suffice for not only this standard, but I think it would also serve to do well that it is a documented process that you have for your camp that then can live beyond one individual or one culture. Does that make sense?
Yeah, it does. Thank you.
Yep. And really, it's kind of thinking about what's intentional. Are we being intentional about that? But that's a great question. And for many of these, with regards to written documentation, it has to do with, have we really thought about that? What are the pieces that we need to think about? And I would also suggest that if you don't, and you may, but may not, is that there are those that are sometimes in our camp environment or that you might want to recruit from the hospital that have to do with psychosocial health, and even invite them to say, hey, we'd love to have you consult and say, what should we be thinking about as we do this? And is there something that maybe we haven't thought about? Because here's one of the things that I've learned is as a camp director, I'm really good at a lot of things. And there's also a lot of things I'm not good at. But I've learned to be able to pull people that are good in those things on the team, and that makes us a better camp, a better organization, and a better team. So there you go.
Appreciate
great.
that.
Yeah, great. Any others that want to, either you can, once again, if you want to go off mute and you want to ask the questions, if you want to type a question, please feel free. Would love to answer those or attempt to.
Say, Brian, this is Don. If you could throw me we put up a library today of examples of policies, and if you could throw me the presenter screen, I will show that to the group. So, because they will be looking at this when they go through their own process.
I think I can do that. So I'm going to do it as Don, the organizer.
Right. Change the presenter to me.
Yes, I did that.
Okay. Can everybody see my screen okay right now?
I can right now.
It says Cat Periwinkle across the top. This is the portal, and if you haven't been there yet, I'm sure the next month or so you're going to be spending a certain amount of time. Something new was added today, and that was Jennifer, bless her heart, went through and collected a whole bunch of gold ribbon standards to serve as examples. On your portal page, you'll notice up here, name of the camp home, administration dashboard, examples of gold ribbon standards. So if you click on that link, that's going to take you to this document library. Okay, and you'll notice each one of those folders is identified with and it's associated with the standards. For instance, let's go down here and take a look at this. The one that Larry just talked about.
Yeah, 6.1.
Was 6.2, and we have 3 examples there. Yeah, these are all PDF files. If you click on them, you can take a look at what other camps have proposed, except for that one, which is obviously blank. Oh, no, here we go.
Oh no.
Okay.
We're just slow.
Well, there's that too. But this is a standard that came out of Sunrise Day Camp out of Long Island. And I'll take another a look at another one here. And what we suggest in this particular case is you can use those to sort of stimulate some thought. You can use them as sort of a general outline, but obviously these are only meant to be examples, and you need to take whatever thoughts you happen to have. If these prove to be a helpful construct, that's great. But really, at the end of the day, every one of your policies obviously need to be particular to your particular camp situation. So that's where you get to it. It's just up here. You're going to see on your home page, you will see this example of gold ribbon standards. When you actually go into the dashboard itself, where you upload your information, and there's also a link at that point as well to those. There's 2 or 3 examples for each one of the standards. So my props go out to Jennifer for that. Any questions? I'll throw it back to Brian right now.
No, it's a great resource. Thank you, Don. And I know we've talked about that for a long time, and so very, very helpful. Very helpful. Great. Other questions that might be out there? I'll pop these back up.
Hey, Brian, I have a question.
Yeah.
This is Larry. Okay. So I'm looking at standard 4.4. Are paid or volunteer staff required to complete medical histories that include the following? So I have 2 questions. One, the DNA, I guess, does not apply. Why is that an option on this one? And then if we select no for these, do we fail that standard or what?
Yeah, I see where you're going with that. So here's where we came, and thank you for asking about the DNAs, because we're still playing with these. So the standard actually just reads that, as you can see on your screen, for those of you that have it, is our paid and volunteer staff required to complete medical history that includes the following. Now, medical history, understand that that is not saying that that a staff member needs to have a chickenpox immunization or have had it. It doesn't mean that they have to have allergies. It doesn't mean, once again, any of that. It just asks whether or not, if you ask your staff for their own health history. So if it just says, once again, do you at some point ask your staff, hey, have you ever had chickenpox, or have you ever had, either the occurrence, or have you ever had, the preventative immunization? And they can provide, and they can say yes, or they can say no. It doesn't mean that they don't have to come. It's the same with allergies, the same with medical and mental health history, and the same with immunization history. Now, the reason why, number one, we think that this is important is that from the point of view that you have staff that are coming up and working with campers, and with that, depending on where your campers are, that a history, knowing that if there is a chicken pox that's an outbreak in camp, who actually, and we've had this actually at our camp, and I know of others, where they have, we had a sibling come up. Actually, we had a patient who was no longer on treatment, but had previously been to a birthday party, came up to camp, and all of a sudden they, guess what? They had chicken pox. And so we had to figure out exactly what to do with that. We also, it was important for us to go through and find out what all staff members either had immunities or had the occurrence, just because that would lend that if they had had exposure later in the week, they might be exposing others if they contracted. Also, and we also asked this of our campers, because of course we wanted to know if they were susceptible, because we actually had to go through and immunize a whole bunch of kids. And I don't know if anybody's been involved with I can never say the word, the gobble and the VZIG. It's not a fun injection to do, but it gives the med staff the history to know that, for instance, for chickenpox and if allergies, if your staff have allergies, if you need to treat them, if they have an allergic reaction, you have history for them. Medical and mental health. Once again, this is so you can support your staff as well. Lots of times we talk about our campers, but your staff are up there, and we also want to make sure we have history with them. Also, their immunization history. rubella, tuberculosis, once again, what's their history? It's not saying that they have to have those, but at least you have that information so your medical team can then say, so with our staff, we know where they are with this if that impacts the community. So that's why we the standard is asked that camps collect that information. So once again, that they have that available. So once again, let me go to the yes, no, and DNA. So for the standard, we are asking that you do this. If you say no, we don't collect that, that's okay. You can definitely do that, but that's something that we're going to have to review as the gold standard committee and say, gosh, does that mean that they're not gold ribbon because it is a foundational practice? And I guess some of that conversation would be, why don't you? We'd love just to know what your theory is and why you don't ask for these when it comes down to the health and safety of the campers that you serve. With regards to the DNA, I can't speak specifically to these because actually, well, I shouldn't say that, because you might have a staff or a volunteer, but you don't have it on every single one. You might have a staff member that's currently going through treatment. If they do, there is certain kinds of immunizations that they cannot take because they're actually on treatment. But that would just be, it just gathers the information so we can find out really why. But the intention is that camps do ask for that information, have that available for their healthcare staff for the safety of the camps they serve. Did that answer your question?
Yes, thank you very much.
Okay, you bet. And I'm actually going to take a note because I need further explanation about the DNA. That's a really good point. DNA is on 4.4. Great. Other questions?
Hi, this is Deb. Can you hear me?
Yes, I can. Hi, Deb.
Hi. I have a question about we rent from a facility and they are ACA accredited and we are not ACA accredited yet, but and so I know when I was on the original call, they said just get their certificate for that for 1.1, I believe.
Yeah, it can, and I'm glad you brought this up, and thanks, Deb, for doing this. Let me go down to 1.1, and because this is one of those things that is kind of a little bit of one doesn't necessarily capture all. So this is where, as camps, and I'll use the example that you just shared, is that as a COCA camp, you rent a facility, and that facility is ACA accredited, happens to be accredited by ACA. It could be by OCA, those kind of things, other accrediting bodies, but the facility is. And that's great, because what that means is that facility and the services they provide have gone through an accreditation system very similar to the COCA accreditation with regards to the operations they provide. And I stop right there because it really has to do with the operations that they provide. And this is where it varies for each one of our COCA camps. That we don't know necessarily what the camp facility provides and what the COCA camp will provide. So to help you out to evaluate that, I'm going to go back and I'm going to go to, and I'm showing once again this this sheet that's a part of the guidelines that talks about an accreditation inventory worksheet. And in going down, it really asks, so what does the camp, the COCA camp provide, and what is provided by others, or in this case, the facility that is ACA accredited? So for instance, if the healthcare, let's just take the first part, if healthcare services are provided by the accredited camp, then the accredited camp has to go through and provide certain documentation with regards to their healthcare staff, their healthcare treatment protocols, all those kinds of things. If the healthcare services are provided by the COCA camp, this is where then the COCA camp has some responsibility because they retain those services, and they also retain some of the liability or some of the responsibility for making sure that they're meeting practices and they're doing their best with regards to that. So with regards to healthcare, it's like, what are the policies and procedures and who are the healthcare personnel? Well, the lucky part is that that's really covered under COCA, the COCA standards under our healthcare standards that ask about personnel, ask about treatment protocols, treatment guidelines. So in that way, you can say, the COCA camp would say, hey, we have the nurses, we have the doctors, we actually treat under our protocols. So in that way, it is accredited, and the other camp does not. But let's take another situation.
Can I ask another clarifying question?
Please.
So originally from the original call was like get their certificate, and we had done this, as we're working through this process, we've filled out that page 5. But if I have their certificate, do you also, and they cover the climbing and rappelling, do you want whatever detail of that as well, or is their certificate gonna be good enough, just marked on here the things that they provide?
Great clarifying question. So if they provide those services, that proof of accreditation, then all of those are taken care of.
Okay, so I don't need any other.
So they do climbing, you do climbing. But what the COCA camp provides, if you're not accredited as a COCA camp, then you need to take a look at some of those and saying, gosh, we actually do the arts and crafts, or we do the cabin counselors.
Right.
Then we ask that COCA camp then to say, so what do the accrediting bodies say that we should be doing with regards to cabin counselors, background screenings, those kinds of things? Or if it's arts and crafts, that what procedures are in place with regards to supervising that staff member that's doing arts and crafts, and what safety precautions are in place, because the COCA camp is retaining that. And so as a part of 1.1, we would ask, well, okay, so if you're retaining arts and crafts, so show us the procedures that you follow with regards to arts and crafts and the safety procedures and that kind of a thing.
Right. I just wanted to know the level of detail that I needed our partner facility to pull from their records.
Yeah, it's easy. If they're accredited for the things they cover, that little shingle or the documentation saying, and at least with the American Camp Association, I know that annually they give you a certificate of accreditation. You're check, you're good.
Okay, perfect. Thank you.
Yeah, great question. Others? Well, while we're waiting, and if I'm thinking of a question or trying to figure out how to get on audio, which is always my biggest struggle. One of the other things that I just wanted to share with this group here is, please, one of the things that we're learning, and we're kind of talking to some individual camps that may not include the ones that are on the call, when you upload documentation, please take a look with regards to the format. We actually had someone do it. I think it was probably a Mac product. I'm not a Mac person. I'm a PC person. But there was actually some documentation that was uploaded with a Safari web browser, and it was their documentation. And for other folks, if they didn't have that browser ability, they couldn't open it. So if you're uploading documentations, think about, usually the most common is doing it in a PDF. Even if you need to transfer that into a PDF, that would be really helpful for us and for visitors, so that they don't have to figure out compatibility. Some of you have probably already thought about that, but I know that usually common things of Word documents, or especially PDF documents, are pretty universal. But like I said, if it's specific to a certain browser, I don't have Safari, and I know that some Chrome, for instance, some things, they save it in Chrome, or even Google Doc. With Google Docs, sometimes you need approvals to get on and to view Google Docs. So if there are certain kinds of browser-based documentation, if you can kind of think about transferring that into a PDF format, that would make it easier on visitors, just as a note. We've been learning as we've been going along, so I thought I'd share that with the group.
Yeah, Brian, this is Don. I'd like to jump in one other thing.
Please.
And that is the portal has a couple glitches to it. We're working on a completely new system, which unfortunately probably won't be introduced until after you all have dealt with what we have now. But anyways, there are occasions in which during uploading files, people will get error messages coming from the portal itself. The best we can tell, those error messages are generated under two conditions. One is it's a rather large file, and the internet connection is slow enough such that the system looks at it and thinks that maybe the files are hung up, and it will generate an error message. The other eventuality is the case, apparently, that if the browser cache itself can cause this. Now, there are some technical...
Don, I just want to interrupt. So that's a geeky term of cache. So in other words, it's the memory that's in your computer. Is that what it is?
It's okay. Well, it's stored in the browser itself. But what this all means is, and this is to address your question, Brian, is what both of those conditions mean is pick up the phone and call me, or send me an email message, because we had a case with Nighthawk Ranch, which was doing a number of uploads. They kept getting these error messages. They got frustrated, and I felt really bad once I found out about it. And it was a relatively simple matter at that time. They sent me their files. They told me where the files went. I uploaded them to the back-end system.
Got it.
I don't want anybody to agonize over this and assume you're doing something wrong. There are some definite issues associated with this portal. We're working through them. So in the meantime, don't get frustrated. Don't get angry. Get on the phone and give me a call. It's back to you, Brian.
Thanks, Don. That's great. Other questions from the crew out there?
Hey, Brian. Mike at Camp Sunshine.
Hi, Mike.
When my associate director of operations was going through, she noticed that 6.4 was not on there yet.
Ooh.
On the portal. On the portal.
It's on that.
Well, I'm not going to scroll through this then. I'm going to verbally knock on Don's head.
Yeah, no.
Hey, can we check on that? And thank you for bringing that to our attention.
Yeah, Michael, you found out about 20 minutes before we did.
Okay.
I'm going to see in the next day or two if we can correct this. And we will get back to you on this, okay? But there are some of those in which 6.4 are missing. There are others in which 6.4 are there. Okay. If anybody has an explanation, I'll be happy to buy you whatever you can order at Starbucks at one sitting, because right now it's a mystery to me. So we will.
I'd say it was a glitch.
Yeah,
yeah. I'd say it's a glitch. Does that count?
A bug, a glitch, or something. So, but we'll be back in touch with you on that. But thank you.
All right, thanks.
We are working on it. Yes.
I just say that you're witnessing excellence in development with this program. So thank you for helping us get better at what we do. Other questions? And if it's going all that smoothly, I'm very excited. Either that or it's those that say, oh, I haven't even started yet and I got to get it up early. Those will be the ones I get the emails and the calls, but I invite that, as well as from all of you, that as you're going along, if there's clarification on any, I appreciate that. Matter of fact, I got an email sitting in my box, actually from a visitor that just wanted some clarification. So all these are very helpful for us.
On something like the records retention, this is Deb again from Camp I. On something like the records retention, you just want our policy of what we're doing, because or do you want a print off of an example, because ours is in an electronic system? Yeah,
great question of clarification. Which one is that? Can you remind me, Deb? Do you know?
Oh, you know what I
know. I'm surfing and I'm not finding it. But let me just answer that question. So with regards to record retention and record retention, yes, this can be paper, it can be electronic. There's all different kinds of ways that this happens now. I think the intention is for the COCA camp to take a look at their retention policy. And I know that this varies according to what kind of documents there are. It also, I'll be honest with you, I've had conversations with legal counsel with regards to this, and it varies even amongst those quote experts.
Right.
And I think, and so it's really hard to kind of say, here's what best practice is out there, or foundational practice with regards to record retention generally. Even in our corporation, we just had to kind of make a policy on what we were going to do, and then we follow that. So really, what we're doing is, no, it's not necessarily to have a sample. Really, it's to kind of think of what is your retention policy, and some of the things that you might want to think about is whether or not, if you have as a business, you might have retention policies with regards to personnel that are at camp. Financial stuff really doesn't involve necessarily the program end. If you want to do that, I think it's important for an organization to think about financial records, contracts, those kind of things, especially if you have a contract, if you're renting a facility or a service. How long should you retain those? Definitely taking a look with regards to camper applications, volunteer applications, employee applications, also with regards to healthcare information. What do you want to do as far as how long will you keep those? Definitely if there's treatment records, incident, accident report records, all of these, different categories might require different kinds of time frame. And some of that might have to do with either state laws, province laws, federal laws, all of those things. And once again, we're not suggesting what they are, but it's worthy of the organization to take a look at those and say, so how long should we keep those? Some of it has to do so that if there is a challenge, I know that, for instance, ours, if we have certain treatment records, we have certain incident accident report records, even camper applications and medical information. How long we keep those is based many times on a camper's age of majority, a legal term of when they turn, and then even some time after that we retain those, because certain kinds of challenges with regards to care can come back to an organization a certain amount of years after even that child turns 18, if that's the legal age of majority. And so do we want to have those records available so that we can then help support that camper if there was a situation that developed either outside camp or defend the organization in a situation? So all these are the things that we ask you to intentionally look at. And once again, this is where I would suggest involving some legal counsel and for your particular province or state, as well as federal implications of what that have to be. And so really for the compliance, it might just be for these certain categories, here's how long we're going to retain those, whether or not if they're electronic or whether or not if they're in paper, or if you're transferring paper into digital, but what does that all mean and in what way you'll do that? So that's really what we're looking for, is that intentionality, that you've looked at that for the safety of campers, the safety of employees, safety of volunteers, and for the safety and liability of the organization.
And then at the on-site visit, is that something you just want to see the policy, or is that something that you're going to want us to pull up a record?
Yeah, to be honest with you, I would imagine, as a visit point of view, is if we see that documentation ahead of time, that's not something I'm looking at, because it's not like, hey, we want to see the vault of documentation and make sure that you're doing that. It really is saying, hey, do you have a policy? If you have a policy in place, that really would be checked out in the policy thing. I don't know if I'd ask for that there. I might refer to it and say, hey, by the way, how long do you keep these? Do you know what your policy is? Might be the question. And then it's kind of like, oh, I can look that up. Let me find out. Because to be honest with you, we're not going to want to see those. And I think then and to be honest with you, from COCA's point of view, then the burden of following that policy is up to that camp. If you've documented what you're doing, then following it's up to you, not necessarily to our visitors.
Okay, thank you.
Yeah, great question. Any others? And once again, I would even say that if you want a reference with regards to what some camps are doing with with regards to documentation, check out that resource that Don just shared. Or once again, I'd be happy to share ours, but with the caveat that you run that past somebody that has a lot of initials after their name in that field, just to make sure for the organization that you're doing due diligence. And I'm looking to see, and Jennifer, I see you're on, but you're muted. Are there any other things that you've run into that might be helpful for those that are still on the call with regards to their documentation and getting ready for their visit?
I think that's it so far, Brian. You've mentioned everything that we talked about in an email this morning. So I think so far that's it.
Okay. Just wanted to give you that opportunity. Thank you.
Thanks.
And really appreciate both your and Don's help in the administration of a lot of this. Very much so. Well, I think my thought is if there's not other questions, I don't necessarily want to end this in case somebody couldn't get on earlier, but if there are those that are on, don't feel bad that if you want to nod off or log off, I should say. Don't nod off, that's not, well, you could do that if you wish. But if you wish to log off, that's totally fine. No harm, no foul. Once again, if you want to follow up with regards to if there's anything additionally said, we are recording this. But I just wanted to be available for those that are here that are on.
Thank you.
Yeah, definitely.
Thanks, Brian, Dawn, and Jennifer.
Hey, appreciate coming in, and we could be here for you.
Great. If we have any questions, we'll give you a shout.
Yeah, please use my email. Use my phone number. That should have been on the orientation slides as well. So, but thanks. Thank you.
Great. Thank you.
Bye.
Well, Brian, what do you think?
Well, I just want to be, I think I'm glad that we had this time. I think that, I just want to see that, because I know that we still have quote another 20 minutes. I have no problem hanging on just in case somebody says, oh, I wasn't able to get here, but I got a burning question. I would hate to, and you said you were going to be on for an hour. So I want to make sure and be respectful of that.
Yeah, I'll tell you what I might do, though. I might pause the recording. What do you think?
Yes.
Yeah, you totally can. You totally can.
Okay.